Now I'm going to show you a patch test. This patch test was published in the National Library of Medicine amongst thousands of other pieces of aromatherapy research. And they were using in this research study lavender essential oil to reduce both diastolic and systolic blood pressure in cardiac patients in the ICU. And they were having these cardiac patients inhale lavender essential oil. Well, you wouldn't want to have a client inhale something in the ICU during open heart surgery if they're allergic to it. So they were conducting patch tests first to make sure that there's no allergy. So here we have lavender essential oil. And what I'm going to do, this has a nifty little dropper to it. So I'm just going to drop a tad of essential oil. You notice her ankle has a little bit of viscosity there. But we're going to put this on the inside of the ankle where the skin's fairly sensitive. You could probably do this on the inside of a wrist as well. And then as a patch test, we're actually going to take a Band-Aid and we're going to cover that lavender essential oil with that Band-Aid. Now, if they're not allergic or sensitive to lavender essential oil, trapping that into the skin will have no effect. If they do have a sensitization or irritation, when we peel that back, it could be very red or blistering. Okay. So, you'd probably want to check on this in about 2 minutes and leave it on for as long as 10 minutes. When you're going to check your bandage and make sure it's okay, you're just going to peel it back and look at the skin. And if it looks acceptable, you might want to put another Band-Aid on there and leave it for 10 minutes, or just come back 10 minutes later and check it just to make sure there are no further changes. The skin has been unaffected. This is a neat application. We usually wouldn't put essential oils straight onto the skin, but lavender essential oil down near the ankle, if they were going to react to it, then they do have a sensitivity. Most people will not overreact to one drop of essential oil on the skin, but some people are sensitive. So that's why we like to do these patch tests. Not only is it good for inhalation and making sure you're not exposing someone to something they're allergic to, but additionally, you'd like to make sure that the concentration when you're blending for massage cream or massage oil, let's say they love lavender, but they're a little bit pink on your patch test, you might just want to use a super weak concentration of lavender, maybe 2 drops of lavender essential oil for 6 ounces of oil or something like that. So patch tests are extremely valuable. Not recommended to use essential oil on a client who had a negative reaction with the patch test. The choice will be yours, and now you know how to perform one on your own.